recover faster and feel stronger after childbirth, or why certain newborns have fewer health issues and better immune systems, it might come down to the way they were born. In this video, we'll look at some surprising advantages of normal delivery that go beyond a quick recovery. These benefits not only make a difference for the mother's health, but also set the stage for the baby's lifelong well-being. If you're curious about how a natural birth can impact everything from bonding to chronic disease prevention, stay tuned. The facts might just change the way you think about childbirth. It's a humble request to please subscribe my YouTube channel. Number 1. Shorter recovery time. One of the key benefits of normal delivery is a quicker recovery for the mother. Unlike a C-section, which is a major surgical procedure requiring significant healing time, a vaginal birth generally allows women to recover faster. Mothers can often resume normal activities, including walking and light chores, within a few days. There's less reliance on pain medications, reducing the risk of side effects. Moreover, with fewer complications such as infections or blood clots associated with surgery, the body's natural healing processes are more efficient. The hospital stay is typically shorter, allowing mothers to return home sooner, contributing to emotional well-being and a more comfortable postpartum experience. This quicker recovery facilitates an easier transition to caring for the newborn and bonding with the baby, which can be beneficial for both maternal and infant mental health. In essence, the recovery from a normal delivery tends to be less invasive and more conducive to immediate postpartum adjustment. Number 2. Lower risk of respiratory issues in babies born through normal delivery have a reduced risk of respiratory problems compared to those delivered by C-section. During vaginal birth, the physical pressure exerted on the baby's chest helps expel amniotic fluid from the lungs. This natural process ensures that the lungs are cleared and can function properly at birth, decreasing the likelihood of respiratory distress. Additionally, babies born vaginally receive a surge of stress hormones like catecholamines, which prepare the lungs for effective breathing by enhancing lung fluid clearance and encouraging the absorption of oxygen. These hormones also promote the maturation of the lungs, reducing the chances of conditions like transient tachypnea of the newborn (TTN), which can cause rapid breathing shortly after birth. In contrast, babies delivered via C-section may have higher fluid retention in the lungs, making them more prone to breathing difficulties. The natural hormonal and physiological processes during normal delivery thus contribute to better respiratory health right from birth. Number 3. Enhanced gut health for baby. Babies born through normal delivery tend to have healthier gut microbiomes, which play a crucial role in immune function and overall well-being. During vaginal birth, babies are exposed to beneficial bacteria from the mother's birth canal, including lactobacillus and bifidobacterium. This exposure helps establish a diverse and robust gut microbiota, aiding in digestion, nutrient absorption, and immune system development. A healthy gut microbiome can protect babies from infections, reduce the risk of allergies, and even lower the likelihood of obesity and chronic diseases later in life. In contrast, babies born via C-section may have delayed colonization of beneficial bacteria, often acquiring more skin-related bacteria instead. This difference in early microbial exposure can impact a baby's long-term health. Moreover, studies suggest that a well-established microbiome positively influences brain development and behavior. By fostering a balanced microbial environment from birth, normal delivery supports the baby's digestive health and strengthens the immune system, laying a strong foundation for lifelong well-being. Number 4. Better initiation of breastfeeding. Normal delivery significantly supports the early and successful initiation of breastfeeding. Hormonal changes during labor and delivery, such as increased levels of oxytocin, enhance maternal bonding, and stimulate milk production. This hormonal surge encourages the letdown reflex, making it easier for the mother to begin breastfeeding soon after birth. Additionally, skin-to-skin contact, often practiced immediately after a vaginal birth, promotes the baby's natural rooting reflex, helping them latch onto the breast more effectively. Studies show that babies delivered vaginally are more likely to start breastfeeding within the first hour of life, known as the golden hour, which boosts the chances of exclusive breastfeeding. Early breastfeeding helps stabilize the newborn's blood sugar, provides vital antibodies, and strengthens the mother-baby bond. In contrast, mothers who undergo C-sections might face initial challenges due to delayed contact or post-surgical recovery. Normal delivery with minimal medical intervention facilitates an optimal environment for initiating and sustaining breastfeeding, benefiting both mother and baby. Number 5. Lower risk of surgical complications. Normal delivery avoids the risks associated with major surgery, making it safer for many mothers. Unlike a C-section, which involves surgical incisions through the abdomen and uterus, normal delivery does not require anesthesia, minimizing the potential for adverse reactions. This absence of surgery reduces the likelihood of complications such as infections, excessive bleeding, blood clots, and damage to surrounding organs like the bladder or intestines. Recovery after normal delivery is typically faster and less painful without the added stress of healing from surgical wounds. There's also a lower chance of complications in future pregnancies, such as uterine rupture or placenta previa, which can be higher after a C-section. Additionally, a non-surgical birth decreases the risk of scarring and adhesion formation inside the abdomen, which can lead to chronic pain or fertility issues. By avoiding these surgical risks, normal delivery supports a healthier postpartum experience, enabling mothers to recover quickly and focus more fully on their newborn. Number 6. Promotes mother-baby bonding. Normal delivery fosters a stronger and more immediate bond between mother and baby, which is crucial for emotional and psychological well-being. During vaginal birth, the surge of hormones like oxytocin, often called the love hormone, promotes feelings of closeness and attachment. This hormonal boost enhances the mother's instinct to nurture and care for her newborn. In addition, immediate skin-to-skin contact is more feasible after a normal delivery, allowing the baby to recognize the mother's scent, voice, and touch right away. This early contact has been shown to regulate the baby's temperature, heart rate, and stress levels, promoting a sense of security. Such bonding experiences are linked to better breastfeeding success and long-term emotional development for the child. Unlike C-sections, where recovery and surgical procedures can delay initial contact, normal deliveries allow for uninterrupted bonding during the crucial first moments after birth. This immediate connection not only benefits the baby's emotional health, but also positively influences the mother's confidence and satisfaction with the birth experience. Number 7. Reduced risk of certain chronic conditions in babies born through normal delivery have a lower risk of developing certain chronic health conditions later in life. The exposure to beneficial bacteria during a vaginal birth helps establish a healthy gut microbiome, which is crucial for immune development. This early microbial exposure is associated with a reduced risk of allergies, asthma, and autoimmune conditions. Studies indicate that children born vaginally are less likely to develop obesity and type 1 diabetes, as their metabolic and immune systems benefit from natural birth processes. Additionally, the physical stress of passing through the birth canal activates the baby's stress response, releasing hormones like adrenaline and cortisol that aid in lung development and overall physiological resilience. This hormonal activation can have long-term benefits, such as improved cardiovascular health and reduced susceptibility to stress-related disorders. In contrast, babies born via C-section miss these critical hormonal and microbial exposures, potentially increasing their vulnerability to chronic conditions. Normal delivery thus provides a natural foundation for lifelong health and disease prevention. Thanks for watching, and don't forget to like, share, and subscribe.